Hi everybody, my name is Alex Gillespie and today I'm going to be presenting my dissertation project. Just a quick personal message just before we start. So I'd just like to very much thank some of my classmates that have worked on the project with me and helped collect the data. So they are Michael Pendlebury, Chloe Fabian and Marissa Basson. So thank you very much guys for your hard work. We finally got to the end of the project and it's a shame that we're not going to be working together anymore. It's been really, really fun couple of months. So thank you very much. And as you can see on screen guys, so my project title is Wellbeing, an important concept for therapeutic interventions. So just a little bit more about me. So I'm a second year student, second year counselling student from Bangor University, and at the moment I'm currently still on placement. I've got over 70 hours at the time of recording this video, and I'm hoping to complete my 100 hours course requirement very, very soon. And in my practice as a student counsellor, I am what you'd call a cognitive assimilative counsellor. So I work primarily within a cognitive model of counselling, but I can implement other therapeutic aspects, such as behavioural therapy, psychodynamic and person-centred as well. I find that it gives a great deal of flexibility when working with clients because no two clients are the same. So just a little bit of background literature before we go any further into the study. So it's going to come as no surprise that COVID-19 has had a profound impact on the general population, and this is a finding that is consistent all over the world, not just in the UK and Western Europe, where typically most research is carried out. Overall well-being levels have decreased, and again, that's going to be no surprise, and that finding is almost universal. Due to the actual effects of the virus itself, the social isolation, and just the total despair that we all found ourselves in. I'm sure everybody can agree it was a very, very scary couple of years. And one finding that's actually interesting from the UK that was published in 2022, so that's Chen and Lukoc. It was actually noted that mental health disorders were on the rise in the UK prior to the pandemic, so you can only imagine just how much that has increased further since coming out of lockdown and all of us experiencing what we went through. So at this moment in time where more and more people are utilising mental health services, taking time off work and just really, really struggling to get by, it's more important now than ever that we can maximise our psychological based interventions as effectively as we can. Obviously working with clients with different organisations, we don't always have many sessions. Some organisations may offer 3 sessions. Some may offer 6, that's what the NHS typically offers. And obviously not everybody can necessarily afford to go private. So the time we have with clients is very, very precious. So being able to maximise our interventions as much as possible is definitely of the utmost importance. So one topic I'm going to be talking a lot about today is the concept of well-being. So it's a really, really, really important concept in understanding mental health. So well-being, what is well-being? Well, it can be described as a complete state of physical, mental and social well-being. So it encompasses all 3 domains. And it's so important in regards to mental health because it's been so significantly associated with improved health outcomes. So one of the studies on screen, Licello et al. 2019, that was a longitudinal study. So that was done over 10 years. And this is where participants were monitored after finishing mental health services, and they were monitored over 10 years, and it was found that participants that reported higher levels of well-being at any point in those 10 years, right from the beginning to the very end of the study, showed much higher recovery levels than those who had low levels. And that's just, although that's just one study, that really gives quite an insight into just how important well-being is, especially if that could still have an impact up to 10 years later. And as a result of well-being such an important topic, certain psychological therapies actually do target well-being specifically. So one very good example would be cognitive behavioural therapy, which is the NHS's primary go-to for mental health therapies. And that potentially is why CBT has such high efficacy rates, because it's able to target well-being and the effects are maintained after therapy. And any first year counselling students watching this, so well-being is going to be coming up a lot for you guys. So well-being is typically used as an outcome measure. So before joining a service, a client may fill out a questionnaire, and based on their scores, that can give an indication as to how high or low their well-being is and to how high or low their levels of psychological stress are. One of my placements is with Age UK, and they do this before joining a service at a 6-week point, and then if therapy is extended beyond 6 sessions, every 6 weeks, every 6 sessions, this measure is measured again. And although there is a bit of a debate about assigning people labels and numbers, it is very useful in seeing how effective treatments are, and also getting the right help for clients. So if a client scores really low on wellbeing and they show a lot of psychological distress on test scores, that can help refer them to better services and to more experienced counsellors and mental health professionals, and get them the help they need in a very short space of time. So that is one of the advantages of using wellbeing as an outcome measure. However, as I've already said, well-being is very important in our understanding of mental health, but it's not the only factor at play. So obviously human beings are really, really complex, and there's lots and lots of different things that can make us happy, that can make us sad, and that can make therapies effective or make them really ineffective. And one of those is resilience. So resilience is a really important concept, especially in relation to well-being. So resilience can be described as an individual's ability to regain or maintain mental health during times of stress. So people that have higher resilience levels typically have reduced mental health disorders and typically score lower on measures that are designed to measure psychological distress. And as I've already said, it's important in relation to well-being because a link has actually been identified between resilience and well-being. So typically, the higher resilience levels that you have, the higher the well-being levels that you have as well. However, this link is actually not very well explored. So there are studies out there that do support this, but there's also studies out there that contradict that finding. So the evidence base is growing. It just hasn't got to the point yet where there's a more conclusive evidence base regarding this link. But it is important to look at because combining these two factors could help improve mental health outcomes in psychological interventions. So if you want to target people that have low levels of resilience and low levels of well-being, you can custom design interventions for people. And a really good example of that is mindfulness-based stress reduction. So that targets resilience. And what's been found in research is that then, coincidentally enough, improves levels of well-being as well. So as I say, mindfulness-based stress reduction is a really good example of combining those two aspects, and that therapy as well typically has quite high efficacy levels. And one final factor that's very important in our understanding of mental health is psychoeducation. So psychoeducation is quite literally information regarding mental health conditions and their management, and that has been very much associated with improved levels of well-being. So what you might find being out on placement for any first-year students watching this, clients may start sessions very, very nervous, very, very scared. They don't know necessarily what's going on. They just know that they're not well, and they don't necessarily understand why. And it's quite sad to see some people just so broken and sad, and thinking that they're quote unquote not normal, when in reality what they're experiencing is very, very normal, and there are lots of people out there that are going through the same. So it's literally just about explaining what a condition is. So for example, anxiety, and then maybe some of the symptoms that are associated with it and how to manage it. And the more knowledge people have, the better able they are to cope. And that's what research typically shows regarding psychoeducation. However, there's actually no research that explores the link between resilience and psychoeducation. So there is a gap in the literature there. And what is interesting with that as well is that studies that have looked at well-being and resilience and found the link between them, and one study in particular, the study that's on screen from 2021, the researchers actually noted that psychoeducation may be acting as an extraneous variable. So that environmental factor may be affecting the results of the study, because that study in particular was done on nursing students. And what you'll often find in wellbeing research is that it's typically done on students, medical students. Not too sure why that is, but that's quite a common theme in the literature. So you could argue that medical students, trainee doctors, trainee nurses, they may have higher levels of well-being and resilience because they have more knowledge about how to manage these conditions compared to just an average member of the public. So by exploring this link more effectively, it could really help, again, focus those interventions and target certain areas and improve the efficacy rates that come out of that. So moving on to the present study, so we aim to explore the link between well-being, resilience and psychoeducation, and it was hypothesized in our study that low levels of resilience and psychoeducation would in turn result in low levels of well-being. So the methods, so initially 119 participants took part in our study, and these were all recruited through social media via opportunity sampling. So a link to the study was put up to the website Qualtrics, which is a fantastic place to put surveys and gather a large amount of data in a very short space of time. Participants were given information about the study and were told the aims of the study, and obviously if they wanted to click on it, they could just follow the link and it would take them straight to it. And when participants finished reading the consent forms and filling in some general demographic questionnaires, they were then presented with some of the psychological measures. So one of them is the Warwick-Edinburgh Mental Wellbeing Scale, which is one that I have used on placement, which, surprise, surprise, measures levels of well-being. So a high score on that indicates good levels of well-being, and low indicates typically poor levels of well-being and increased psychological distress. We also implemented a 9-item resilience scale to measure, obviously, positive coping strategies and resilience within participants. And we also implemented a custom measure. So there's no reference for this at the moment, and apologies, it's not very clear on screen. I don't know why it's coming up a little bit blurry. But this was a custom measure that was made by one of my colleagues, because to date there's no reliable measure for measuring levels of psychoeducation. So this questionnaire was split into 2 parts. So participants were first asked, have you heard of these concepts? So for example, empathy, mindfulness, self-esteem and mental well-being. They could indicate yes or no. And then the next part, the second part of that questionnaire was, have they experienced and or do they practice these concepts? So for example, mindfulness or self-actualizing. It was just interesting to see the difference between what people understood and what they could actually put into practice. And the results of the study were quite interesting. So unfortunately, 73 participants had to be excluded from the study due to incompletion of the questionnaires, or finishing the questionnaires far too quickly, which would indicate that they've typically just clicked any answer, and therefore the data may not be as reliable to use in the study. So all in all, that gave us 46 participants remaining, which was still quite a reasonable amount, and gave us a good body of data to use. Upon further analysis, we noticed that the data wasn't normally distributed, so we decided to do non-parametric testing for this. One of the tests we did was a Spearman's correlation, and as you can see on screen, there were some relationships between all the variables. So we found a strong positive relationship between well-being and resilience, a weak negative between resilience and the psychoeducation concepts, and then a very weak negative relationship for well-being and psychoeducation experiences. And similar results were also found specifically looking at psychoeducation and well-being as well. We decided to do further analysis, so we decided to look at linear regression. So an advantage of using a linear regression is it's used to predict the value of a variable based off the value of another one. So the variable you want to predict would be the dependent variable, and the variable that you're using to predict the other one would be called the independent. So in this particular context, well-being was our dependent, and then all the other measures were the independent variables. So as you can see here, we found a moderate effect for well-being and resilience levels. We found a strong effect for well-being and psychoeducation concepts. We also found the same for well-being and the psychoeducation experience. And then we also found a strong effect for resilience levels and psychoeducation concepts. And then the same again for resilience and psychoeducation experience. So for the next part of our analysis, we looked at doing a stepwise regression, which is a slightly deeper analysis than a standard linear regression. However, we encountered a problem when doing this. So the problem was multicollinearity. So basically, I'll try to explain this as best as possible. Stats is not my strong point. But basically, the goal of a regression analysis is to isolate the relationship between each independent variable and the dependent variable. And a stepwise regression would help us basically look at which independent variable best predicted the impact of on the dependent variable. So was psychoeducation, did that predict higher well-being scores than the resilience levels? Unfortunately, what we found during the analysis, and I've put an example of it on screen, is that the independent variables were very, very much collinear with each other. So that means that when, for example, psychoeducation levels went up, so did the resilience levels. And when we put all of that into the same regression model, SPSS did not like it. And there's an example you can see on screen where it says excluded variables. And in that particular regression, it decided to exclude the concept scores for psychoeducation. So unfortunately, the overall regression model wasn't a good fit. So unfortunately, we couldn't go ahead with that further analysis, which was a shame. But that being said, the data that we have gathered so far still proved to be really, really interesting. It was just a shame that we were unable to delve further into the analysis at this point in time. And now moving on to the discussion part of the presentation. So as it was hypothesized, so high levels of resilience led to high levels of well-being, and the same was found for psychoeducation as well. And these findings are consistent with previous research, so this was a really good finding for us. And these findings also developed previous findings as well, because as I said earlier in the presentation, quite a lot of the research into resilience and well-being has been conducted on students, particularly medical students. So our sample did consist of some students. We were able to ascertain that much from the demographic questionnaires. However, we did also have quite a wide degree of variability between students and also members of the general public. So you could argue that the results from our study are slightly more generalizable than previous research, and as I say, it does also develop previous findings as well. So it was a real good result for us. And in particular as well, our study develops the concept of psychoeducation. So as I've mentioned before, psychoeducation has been linked with well-being, but there's been no research looking into resilience. So we did find a link between psychoeducation levels and resilience levels, which was a real good find for us. And we also further developed the concept of psychoeducation purely because in previous studies, when they've looked at psychoeducation and well-being, they've looked at what's called active psychoeducation. So this is where a therapist or a counsellor is directly involved in that process. So by delivering the information in person and helping clients implement that information as well. So if you were talking about breathing exercises, by explaining the benefits of a breathing exercise and then by checking if clients are doing this, that's active participation, active psychoeducation, sorry. If a counsellor was to just give a leaflet or a link to a YouTube video and ask a client to do it in their own time, that would be known as passive psychoeducation. Now, our study didn't necessarily differentiate between the two, so it is entirely possible that in our sample, there were people who maybe weren't seeing a therapist and who were actively engaging in psychoeducation concepts themselves. So further research may further wish to look into this and differentiate between active and passive. But obviously the current study does still offer that chance that there was some passive psychoeducation. So that's a really good result for us as well. Future research may wish to improve upon our study by perhaps increasing the sample size. So although it's not uncommon to get statistically significant samples from quite a small amount of participants, generalizability could be called into question. So, for example, a study of 46 statistically significant participants versus a sample of 119, which is what we could have potentially had. Obviously, it goes without saying that the 119 participants would yield more generalizability and perhaps more statistical power. And that's where I feel that our study was lacking in some parts. And further research may also wish to have a look at multicollinearity as well and ways of overcoming this to get the further stepwise regression analysis to further explore this concept. So thank you very much for listening to my presentation. It's been a pleasure. If you've got any questions, feel free to put them down in the comments below and I'll answer them as soon as possible. And also the link for the handouts for this presentation will be in the comments as well, complete with all the references that I've used. Thank you very much.